This is the Emergency Medical Minute, sponsored by Health One.
All right, everybody. So, medical minute on sedation in the emergency department for intubated patients. And, a lot of times we get patients, they have to be intubated. We want to make sure that they're sedated, and we have to do sometimes some procedures, get them situated before we get them admitted upstairs. But there's been some studies and some kind of discussion about whether or how deep you should sedate patients in the emergency department. There have been studies that have shown that patients who are deeper sedated, more sedated in the ICU tend to do worse. This was an interesting study that looked at when they start sedation in the emergency department, does lighter sedation in the ED lead to better outcomes? It wasn't a randomized trial, but they observed patients and they saw patients and they divided them into either lighter sedation or heavier sedation in the ED. And the first interesting thing was that when patients were sedated lighter in the ED, they tend to continue that in the ICU. If they were heavier sedated, they continued heavier sedation. So, a lot of times things just get carried on. The patient comes up and they're deeply sedated. They say, all right, maybe they just need to be sedated. So that was the first thing. And then the outcomes, they did find that patients that were lighter sedated tended to do better. Fewer days on the ventilator, fewer days in the ICU in general, lower mortality. So, obviously we need to get patients at least somewhat sedated in the ED before they go up to the ICU, but the lightest sedation is probably ideal. Pain control probably helps minimize amount of sedation. So a lot of times, a dose of fentanyl or Dilaudid can really help with the pain of the procedures or of being intubated. And then you can use, lower doses of propofol or Versed or whatever we're using, but the lighter sedation that the patients can tolerate is probably ideal. Any questions? Thank you.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.